Okay, this video is continuing with the book, The Medical Reformation by Peter Rogers. That's me, and we're going to be now doing What is Cancer Part 9. We are on page 530 of the book. That's page 530. Okay, so here this illustration, we talked briefly in the previous lecture about the importance of eating adequate amounts of potassium. K is for kalium. In Latin, that means potassium. Na is for natrium. In Latin, that means sodium. Okay. Magnesium is also needed to run these ATP-dependent reactions. And you need to eat adequate amounts of potassium. You don't need to worry about sodium. You get plenty of sodium just from eating regular plant foods. Okay. Indigenous traditional populations didn't have salt shakers. And by eating a lot of potassium, you can maintain these gradients across the plasma membrane of cells at an optimal level. And that enables you to be most effective at managing your calcium and being able to pump out calcium quickly when you need to do so. Okay, and because normally this pumping through the potassium-sodium ATPase generates a plasma membrane gradient of about negative 65 millivolts. So that's an electrical gradient. And there's a chemical gradient because the concentration of sodium is 10 times higher outside the cell than inside the cell. What this means is sodium wants to come into the cell, both because of the negative charge inside. It has a positive charge, so it's attracted to this negative charge, and to equilibrate its gradient, a tenfold gradient. And this intense desire of sodium to come into the cell enables it to be coupled, the entry of sodium to the pumping out of calcium. And calcium is really the aristocrat ion that determines what the cell does. So that's pretty important. Okay, this is just a quick summary slide about the concentration of these ions, how this is the extracellular matrix. Here's inside the cell, and sodium is 10 times higher outside compared to inside the cell. Potassium is just the opposite. And calcium is about 10,000 to 15,000 times higher outside the cell. So you always have to pump against a gradient to pump calcium out of a cell. Okay. Now we're going to move on to something a little bit different. We're going to talk about, real briefly, the Jack de la Torre theory of dementia. So Jack de la Torre was his PhD, did some of his research when he was in Texas, and he tied off the internal carotid artery in the neck of a mouse. And for the middle-aged and older mice, they would become demented 2 months later. And when he first did an autopsy, he expected to go in there and see a big stroke, but there was no stroke. The brain was simply shrunken on the same side, and that's called apoptosis, the gradual loss of neurons. And it doesn't leave a mess because the neurons, in a sense, die slowly so they can be recycled. Their chemical components can be recycled. And what you'll notice about the mouse becoming demented 2 months later is you'll say to yourself at first, well, gee, not that many people have internal carotid artery occlusions in the neck. And that is true. However, lots of people have chronic cerebral hypoperfusion. That means relatively little blood supply going to the brain. That can be due to congestive heart failure. It can be due to atrial fibrillation. It can be due to overtreated hypertension. It can be due to heart valve disease, aortic stenosis, aortic regurgitation. It can be due to prolonged iatrogenic hypotension after CABG, coronary artery bypass graft, because they don't want bleeding at the anastomoses. They did that to my father, but he came out of it well, but it was pretty scary. I stayed with him in the ICU for a couple days after his surgery. Okay, so we talked about all that, the way you get apoptosis from chronic cerebral hypoperfusion. Okay. Now, let's see, why did I go into that? Well, that same thing can lead to a Warburg effect in another tissue type, and it can be exacerbated by mitochondrial inhibitors. Okay. And also what I've seen is a lot of patients eventually become confused from their chronic hypertension and their chronic diabetes. And once they're confused, they lack sort of intellectual energy. Their chance of ever getting better is zero. I've never seen one of those people get better because it takes a certain amount of intelligence and curiosity to reverse their problem. Okay, I was briefly getting into some chemicals that are neurotoxic, and I think the point I want to make here is a lot of these neurotoxic chemicals are also toxic to other parts of the body, but people aren't aware of them. And part of that, again, is because internal medicine sort of thinks if the coronary artery is open, then all is well. But there's actually a lot more to health than just keeping the coronaries open. And these toxins can be very damaging, especially, for example, I had recently done a lot of study of the immune system and subsequently of mitochondrial inhibitors, mitochondrial toxins. And those are also going to decrease the ability, if they're taken up by the cardiac muscle cells, for the heart to pump effectively. And they're going to lead to more of mitochondria not being able to meet the energy needs of different given cells and of injured mitochondria. And that's going to likely lead to increased Warburg effect and more cancer. So I kind of got off in a couple different directions there. We're almost done with this chapter, just another page or so. Here's a picture of the effect of diabetes on small vessels, like including in the brain. Diabetes, let's see, here's a normal artery, normal capillary to begin with, for example. The red blood cell has to fold back on itself a little as it passes through a capillary because the RBC is about 7 microns in diameter. The capillary is about 5 microns in diameter. These little blue circles are the oxygen passing from the red blood cell out of the capillary, through its wall, and traveling to the tissue, in this case, a neuron in the brain. You also have on the lining of the capillary this yellow stuff, which is the capillary basement membrane that connects the endothelial cells to the deeper cells of the arterial wall. In this case, we've drawn some vascular smooth muscles. It could be parasites in the brain. But the bottom line is with hypertension, you'll get thickening of the smooth muscle of the arterial wall. You'll get also more collagen laid down. With diabetes, you'll get thickening of the capillary basement membrane. And the point is, when this becomes thicker, now you got a thicker yellow capillary basement membrane here than you did here. You've also got hypertrophy of the muscular wall. You're going to have less oxygen transferability from the blood cells to the tissue. And that's going to cause more tissue hypoxia. And that will contribute to the increased risk of the Warburg effect, meaning hypoxia-induced mitochondrial injury in the recipient tissue, potentially leading to cancer. So what I'm trying to say here is all of these things go together, and they can lead to mitochondrial injury, and that can lead to development of cancer in the target tissue. So the smart move is optimize blood flow as best you can by avoiding, for example, high-fat diets and high-sodium diets. Eat your plants so you get your vasodilators, your potassium, your magnesium, your nitrate precursors to make nitric oxide systemically, vasodilation. Also eat, basic alkaline foods, which is your plant foods, fruits and vegetables, for example, in comparison with your meats, which are acidotic. Avoid the mitochondrial inhibitors, which can also contribute to mitochondrial injury. And all of that will reduce your risk of cancer. Okay, so that concludes that last chapter 35. That was a long one. I hope it was helpful.